Some time ago I went to speak to a group of service managers who deal with older people, which I was insulted about. It was a really, really good experience. They really took on board what I had to say. We got a very good feedback. The whole setup was excellent, and I felt that they put me enough at ease, and the verse as well. I put them at ease, and I was able to speak very openly about the service I receive and what's important about it.
We were having a development session for some senior managers and some service managers in older people's services in the City of Edinburgh Council. One of the council's fundamental aims is to involve people who use services in the design of those services. I think the managers found it very powerful. One manager said that it was the best 2 hours she'd spent in a long time in her role as a manager. I think Robert was incredibly balanced in how he presented his story. He told us what things his carers did, what things that the council employees did that were really, really good and worked really, really well. But he also told us the things that we could improve and the things that could be better for him. I think that the training and the coaching that Robert had received had helped to ensure that he got that balance just right.
Debbie and I went along to planning meetings and worked out just how that could be done, and then I went along and did 3 separate inputs on Module 1 on the social model of disability and how that fitted into my life and my support package.
It was good that we were able to involve Debbie and Emma in the working group that we set up to plan the learning and development sessions. They were able to come along to those meetings and to input, to really give their ideas of what would be useful to include in the sessions. So that was really quite useful, and they were able to meet with all the other people in the working group. So that included the agency staff, operational managers, frontline workers, supervisors, and also the other training facilitators. It was good that it was a joint approach. I think it was invaluable really to hear Emma's perspective on the training and what she felt she could bring to that. You know, some things that just we hadn't thought of, practical things about her experience, and I think that was really useful to hear from her directly.
I think having the champions in the room during the training session has been very interesting for us as trainers, both as the designers of the training and also as the deliverers of the training. I think it helps to focus your mind on the issues, but also to be very aware of the language that you're using. I think sometimes in social work and in health we can use a lot of jargon that isn't the normal speech for people. That's helped us be aware of our audience. But I think also it's helped the staff in the room be very aware of how they approach some of their questions and answers as well. And I think also being able to get feedback from the champions about their experience of the training as well, hopefully will help inform any future training that we do.
Having been at the sessions myself, it was interesting to hear people responding positively about Emma in a very constructive way, but challenging them to some of the assumptions that had been made. It generated a lot of informal discussion, conversations in the office, that people were talking about some of the issues that Emma raised. I think what she undertook seemed to me as an observer quite a challenging thing to do, quite a difficult thing to do.
We are also learning how involving people, disabled people, with the right skills, with the right support, can enable us as an organization to have a very constructive and positive conversation with local authorities, and how we can influence in this way by letting people talk, letting people tell their story, have local authority more willing to listen and not being as threatened as professional coming to them and telling them, you know, we need this or you should do that.
One of the main thrusts of policy at the moment is this great buzzword of co-production. We're supposed to all be working together, so service users, voluntary sector, local authorities and people at different levels in local authorities. The Champions really feeds into that very well.
I think this is probably for me, as a workforce development worker, one of the first times where we've been able to really very positively establish a good working relationship with Emma, with Debbie and with LCiL as far as involvement of service users in direct learning and development.
Having a disabled person in the room while you're working on policy or designing a new service isn't a strange thing anymore. It's just normal, and we can have the richness that that brings without having a big hullabaloo and, you know, lots of work to make it happen, that it just happens all the time.
And the thing for me that was very important, because of the preparation everybody had put into it, it certainly to myself and my colleagues didn't come across as a token involvement. It really struck us that people were actively engaging in something that was really important to them. It's a starter and we can build on that.
One of the most powerful things about having Robert in the room is that Robert is the expert in his own life, and he's also the expert in living with his long-term condition. And that's an incredibly powerful thing to bring into a room of people who work in a public service.
Because I think the sense that we've had from people is that hearing people's own experience has had an impact and has stayed in the mind. And I think it's been very good for staff who have their own anxieties at the moment about how are they going to give information about self-directed support to people, to also remember that the people receiving the information, you know, this is a new thing for many of them as well. Just having a conversation with people and being aware of each other's perspectives, and I think having the Champions involved has helped with that.
Having a service user with a disability involved directly was just so powerful. I mean, I can't overestimate, you know, it was just so powerful to hear directly their lived experience.
Sometimes in organisations we get hung up on our own internal issues. We focus on our own internal processes, but actually that's much less important than making sure that people get what they need from us. And one of the benefits of having a champion in the discussion is that it helps you to keep the focus, helps you to keep the focus on the person and what they need rather than what the organisation needs.